Hi, I'm Dr. Bains at Jernigan's Hair Replacement Clinic in Raleigh, North Carolina, and I'd like to talk a little bit today about traction alopecia. Traction alopecia results from prolonged and repetitive tension on the hair follicles. It mostly is found in the frontal or temporal areas of the scalp, but can also be found in other areas. It's frequently diagnosed in women of African descent due to the frequent use of traction hairstyles. The pathogenesis of traction alopecia remains relatively unclear. However, it's felt to be due to inflammation around the hair follicles, which leads to miniaturized hair or lack of hair density. It also occurs in other populations using traction hairstyles such as tight ponytails, bun hairstyles, hair extensions, or the use of hairpins. Initially, traction alopecia is reversible if the cause of the traction is discontinued. However, with persistent traction, it becomes irreversible. Clinically, you can see inflammatory papules or pustules, reduced hair density, reduced hair length, and alopecia patches. Again, the frontal hairline and temporal area of the scalp is generally what's most affected. In persistent traction, patients can develop complete alopecia. In their history, we may also look for any signs of possible inflammation around the hair follicle that they may have developed prior to noticing their hair loss. Generally, when patients present to our clinic, what we're looking for is hair loss in areas where they might have been placing traction. When patients come in for treatment, if it's early on, they can just discontinue the traction they're placing on the hair and the hair will regrow. For persistent traction, the hair loss is more permanent, which needs generally more aggressive treatments such as medical treatments, hair systems, and hair transplantation. Again, I'm Dr. Bains with Jernigan's Hair Replacement Clinic. I want to thank you for your time. Please feel free to visit our webpage for more information at www.jernigans.com.